I'm Chanda Moellenberg and I teach in the School of Nursing at Northwest University. So what first attracted me to teaching, education has always been a huge part of my life, and it's been really empowering to me and has opened a lot of doors for me personally and professionally. And I think receiving education really changed how I see the world and how I see my place in the world and how I can really do what I am set out to do and what I'm called for. So I feel really inspired to be part of a community that's helping students do that. And yeah, really opening doors for them and expanding their world. So I first was interested in nursing kind of from a justice perspective. My parents were missionaries and talked a lot about what they'd seen in the mission field, and kind of as my worldview expanded, I realized that so many people don't have access to good health and education. So I really wanted to do something to support marginalized and vulnerable populations, and nursing was a natural union of my passion, and it would give me skills that I could really leverage to support the populations that I cared about. The thing I like most about teaching at NU is the students and the campus community, and they continue to inspire me all of the time. And I think Northwest students are especially committed, and they care so much, and they don't shy away from asking really hard questions and thinking really complexly about the world. And so it's a really special place where we kind of support those questions about why is there injustice? Why are we seeing these things? What's our role as individuals and what's our role as Christians? It's a really inspiring place to be. It supports kind of that union of academic rigor and skill building with also really supporting from a Christian worldview and kind of sorting through how as Christians do we respond to a world in need. And it's a wonderful place where we can ask those types of questions. Careers that students typically go into from the nursing department is obviously nursing primarily, but then nursing itself opens a lot of doors for students. So a lot of our students start working in hospitals and clinics, and then many of them go on to do work overseas in disaster relief. A lot of our graduates go on to do doctorates in nursing practice, and are primary care providers for patients. So it starts with nursing, but then it really opens a lot of doors, and people have gone into all sorts of different avenues of nursing. So in the nursing program, the types of classes that students take in the program, their first year they really start with some of the fundamentals. They've already taken anatomy and physiology, and then the first year of the program they start building their nursing skills. So we have a skills lab that they start practicing blood pressure and all of the things that you do in hospital IVs. They start working in the hospital for their clinicals. I also teach health promotion their first year, and that's really looking at how to promote health prior to the onset of disease, which is typically a much more effective way to protect people's health. And they also specialize and do a little bit of mental health nursing their first year. They start nursing research right away their second year. They take a little bit more of a specialty approach. They do some obstetrics nursing, they do pediatric nursing rotations, psychiatry, and then they also have an opportunity to spend a month overseas their senior year observing healthcare systems in other countries. So I just spent a month in Mexico, and we have 9 other sites, and students spend a month looking at how nursing practice is delivered overseas, looking at other health systems, looking at other challenges that other countries have, and kind of putting together development and economics and healthcare. So it's a big putting it all together year. And then they're just starting their practicums where they're working on floors and preparing for graduation. One of my favorite moments teaching at NU is certainly on the overseas trips that we get to go on with the nursing school. So I was just lucky enough this past February to spend a month in Mexico with 5 students, and that provided so many powerful teaching moments. But one of them in particular was we'd gone to a farm workers housing facility where migrant farm workers move across Mexico harvesting sugarcane and live in what's typically very hard housing situations. And we'd spent a day doing some healthcare outreach with them, and the students really got to see how socioeconomic status, how lack of access to education kind of really all work together to really impact someone's health more than just healthcare alone. And the conversations we had after that particular situation, they were really vulnerable, they were asking good questions. I really saw some students having aha moments about how all of these things work together to create someone's health. And it was just really powerful. It was really powerful to see the students really think critically, really being vulnerable, really kind of grappling with things that are hard and encouraging each other and kind of finding ways to observe injustice, but then also not be paralyzed by it and find their place and find their role. And it was a really, really powerful moment. One of my favorite things about the NU nursing program specifically is that so many people come into this program with really a heart to serve and really want to help promote people's health and address vulnerable populations and address injustice, but they lack the hard skills. And I think something that's really helpful at Northwest is kind of this combination of the nursing program is very academically rigorous and gives you excellent training and you're very prepared. And so it combines that heart that people have for promoting justice with giving them some really hard skills that they can actually do that. And so I think it's a wonderful thing to watch people who have spent their whole lives really feeling this call and really feeling this pull towards a serving profession start to get those skills where they can actually start doing that.